Hello, good evening. My name is Dr. Khalda Salim. I am the one of the mentor for the MRCPI OSCE. I have with me along my co-mentor Dr. Fozia Ayaz. Both of us are running the MRCPI OSCE group from last 2 years almost. And although we have candidates, not great in number, but whosoever candidates are with us in our group for the MRCPI OSCE, our result is always 100%. Today, I'm thankful to Dr. Hera Majabin also for this session and to arrange this session and to give you an idea about from a very beginning and a basic idea that what MRCPI OSCE is and how to prepare for it and how much time is required for this preparation and how to go about it. So, in what we are going to do in today's session, that we are going to discuss about our what are the eligibility for the exam, who can appear in the MRCPI OSCE exam, and about the exam calendars, understand the OSCE exam format, about different station review types and what are the expectations from you, the examiner, what are the examiner expectations from you. We will learn about the scoring method, which is, and also explore the tips for preparation and how to perform, how to have a good performance in the exam. Now, coming to eligibility for this exam, it's very clear that once you have cleared your MRCPI OB-GYN Part 2 written examination, then you are eligible for MRCPI OSCE examination. Now, once you appear in MRCPI OSCE examination, then maximum 6 attempts you can give, and you have to pass this exam in maximum 6 attempts. And these 6 attempts should be attempted in the 3 years after passing your MRCPI written exam. Now, once if most of the candidate, almost all of the candidate, they do pass their exam, they do pass their exam in the first or the second attempt, because it's not as difficult exam as we consider the MRCOG Part 3 exam, which requires a lot of preparation. The MRCPI exam, if you keep in the balance between the MRCPI OSCE and the MRCOG Part 3, it's the balance is if you keep the hardness of the exam, the difficulty level, it's more toward the MRCOG Part 3 exam compared to the MRCPI OSCE exam. Having said that, it doesn't mean that you should not prepare well for this exam, because as far as the knowledge is concerned, the MRCPI OSCE exam is a lot about your knowledge exam, it assess your knowledge. So if you are appearing for the MRCPI OSCE exam, and the important thing is that you should be good in your knowledge. So coming to the attempts, you maximum 6 attempts, and that should be attempted within the 3 years of passing your written examination. Now, coming to this, coming to the next, the calendar of the exams. Right now in 2025, the exam is being held for the MRCPI OSCE exam on 10th and 11 May it will be held in Abu Dhabi. And then the application date has already been closed for this exam. The next exam, which is going to be held, it will be held both in Ireland. This one also may also being held in Ireland and Abu Dhabi. Always the OSCE exam, one center is the Ireland, and that is the Dublin. Always there is Dublin or some other city. But the one center is the exam, one exam center is always outside the Ireland. That rotates between the United Arab Emirates Center, because since 2023 they have introduced the Saudi Arabia as the exam center, and the third is the Oman Center. So I think in November, this time it's, if we see this time in November 2025, the Riyadh is the exam center. And there is another center, there is another exam, the third, before the OSCE exam was being held twice a year, was in May and November, but due to the so many candidates appearing in exam, the college has decided to conduct the exam thrice, OSCE exam. So one is being held in February. So this time in 2025, the Feb exam was being held in Oman. So so the November exam and October 31st October and 1st November exam is being planned in Riyadh, Saudi Arabia. So these are the UAE, Oman, and Riyadh. These are the three exam centers for the OSCEs, which are being held outside the Ireland. So next exam, if you want to appear in next exam, you want to apply for this exam, then the application it will be held on 31st October and 1st November 2025. The date is 13th August. The opening date when the application will open will be 13th of August 2025, and the closing date is 24 September 2025. Because so many candidates are appearing in the exam, so they once you clear the advice is that once you clear your MRCPI part 2 written exam, you start applying for the next exam. When the application opens, you submit your application for the OSCE exam. The reason being that you will not get immediately the seat for the MRCPI OSCE exam as you submit your application in the first attempt, because so many candidates. So once you start application, they consider your most of the candidates, they get their seat in the OSCE exam in the second, but most of them get in the third attempt. Like once you apply for your exam, start your application, maybe you apply this year in November 2025, then maybe you apply for the February. If you didn't get the seat, when the application opens for the February exam 2026, you apply for that exam. If you are lucky enough, you will get the seat. If not, then next in the third attempt for the May exam, you will definitely get a seat, because once you start your application, they count that application, and in that way your turn come for the OSCE exam. So even if you think that you will not get immediate seat for the OSCE exam because the competition is so high, so many candidates are appearing in the exam, so it doesn't mean that you don't need to apply for this exam. You have to submit the application because that does count, and it will help you to get the seat in the next available exam. So this is a very practical advice which we got when we were preparing for our exam. When we were preparing for exam, so we got this seat. We got this learning that once you start your application, it increases your chances of getting your seat in the next upcoming exam. The MRCPI OSCE exam is basically is a clinical exam. It's a final exam in achieving your membership of Royal College of Physicians in Ireland. In the OSCE exam or in this practical exam, clinical exam, they evaluate your knowledge. They evaluate your problem solving skills. They evaluate how you can diagnose a patient. You can make a diagnosis. What type of investigation you will offer? Can you treat your patient? What are your clinical skills, different clinical skills? And along with that, your communication skills are also being observed when you are performing the station. It's a mode of examination is objective structured clinical exam, as well as it's a clinical exam. Total cases, 7 short cases you will get and 1 long case you will get in this exam. Duration is for the short cases is total 10-minute duration, apart from MRCOG 3, where you will get a 12-minute, 2-minute outside the cubicle and 10-minute inside the cubicle. But here you will get total of 10 minutes in which you have to enter into the cubicle, greet your examiner, read your station, and start your station as well. So it's a total 10-minute duration. You will get actually 7 short cases, but you will have 8 OSCE stations, which means there will be always 1 rest station, which you will be getting. And rest station means that between 3, after 4 stations, 4 OSCE station, you will get a rest station where you will have a 10-minute duration to take rest. If you want to drink water, take deep breath, and prepare yourself for the next 3 OSCE stations. The eligibility is that you must have passed, as I have told you, MRCPI written exam. You must appear for the MRCPI 𝐸 OSCE within 3 years of passing part 1. And must have not attempted MRCPI OSCE more than 6 times. Means after 6 times you have to appear again in the written, which is not that situation for almost all the candidates. Now exam format, coming to exam format, we have 2 type of exam formats. OSCE exam have 7 stations and the clinical exam. Now, first of all, clinical exam means the long case. So let me come first to the clinical exam. The clinical examination, it's called the long case. and it's one long case each candidate will get in the MRCPI OSCE exam. The total duration of the you will see total duration of this station will be around 25 minutes. Each one of candidate will be getting around the either one obstetric case or a gynecological case. It doesn't like this that you will get one obstetric or one long. There is only one long case. So it totally depends upon your luck that you will get obstetric case or gynecological case. So before coming to this clinical exam, once you let me introduce you to the morning of your exam, that once you reach to your exam center and you are there in your exam center, once you reach there by around 8 o'clock or 8:30 in the morning, they will divide those candidates who are booked in the morning session and to two groups. They will divide them into OSCE group and they will divide them into clinical exam group. So you will be divided in all those candidates who are appearing in one session will divided into two groups. The OSCE group will start their circuit stations. Those who are being booked for the long case, they will start their long cases. So if we talk about the long cases, in long case, you will get total, there will be eight cubicles. There will be 8 cubicles for the long case. In each a cubicle, there will be one cubicle of gynae exam center, gynae station, and the next will be ops. So it will be alternate. One candidate will get obstetric case, the next to him will get the gynae case, the next will get the obstetric, the next will get the gynae case. In this way, total 8 or 10, how many station cubicles or how many they have prepared the stations according to the number of candidate you will get. So it will be alternate. So nobody knows whether they will get a long case in obstetrics or a gynae. So you have to prepare for both. And it's totally depends upon your luck that what type of case will come to you in exam. The total duration for this station, once you enter into the cubicle, once the bell rings and you enter into the cubicle, it will be a total duration of 25 minutes. It is a fully observed station with 2 examiners, and you have to take here detailed history. You have to examine the patient or the role player before discussing the case with the examiner. Before the COVID-19, this exam was being held in the hospitals, and there was proper role players and there were role players who are being prepared on whom you have to do the full examination. But after COVID, the things have changed, and now if you are because you are in exam center, in the long case, you will get along with your examiner, 2 examiners will be sitting there. You will have a role player sitting with you, with whom you have to take the history. But all the examination is being performed on the mannequin. And one of the examiner will come and stand by you along your side and will quietly observe that what you are doing in examination. So once you are doing the examination in the long case, you have to speak about the examination as well as, and like you are doing the examination and you have to speak about it so that the examiner also knows. And in this examination also, you have to you have to follow the WHO's hand safety rules that you have to scrub your hands. You have to take the permission from the patient, and that permission, you have to take that from your role player that I am going to examine you. Although you have to do the examination on the mannequin, but you have to take the permission from the role player. Then you sanitize your hand, you go to the role player. Once you sanitize your hand, you take the permission from the role player, you stand along the right side of your mannequin and then start your examination. And before starting examination, the trip and trick here is that have a full a panoramic view of your examination table and see what the instruments are provided to you there. Because whatever has been provided to you there, they are not without a purpose. They are always with a purpose. And the purpose is that you have to use, like if they have provided you in obstetric case with a SIM speculum and a swab, high vaginal swab, it means you have to take the high vaginal swab. Similarly, in the gynec case, definitely you will get a speculum examination. If they have provided you with the pap smear, you have to take the pap smear as well, and which they do provide. So take a panoramic view of your situation, of your mannequin, what are provided to you. And the mannequin will always be covered in the long case when you are performing the examination, will always be covered. And it is required from you that once you finish your examination, you have to cover your mannequin you have to thank your role player and then sanitize your hand and sit down again to get prepared for your viva. In the long case, before there was a situation that it was that once you finish your examination and once you finish your history taking, then you have a complete viva type station with your examiner, where two examiners are asking you about they start you with the differential diagnosis, then they ask you about what investigation you will require, what treatment you are going to give to this patient. Then they will ask you about different scenarios, like if she's endometrial hyperplasia with atypia, then they will ask you if she develops the C endometrium, then what you will do. If it is this stage, what you will do. So it can be a progressive type of viva. But now in some situation, the exam is changed. The examiners are listening to you. They are asking you. Now it's a mixed type of viva. You have to counsel your role player as well, that what is your situation and what I'm going to do with you next. And in between, the examiner is also going to have the question. So it is a mixed sort of viva now in the long case, that it's not totally the viva that your job with the role player finishes once you take the history and examination and thanks the role player for examination. No, it's not like that. Always you will get it will be a mixed side. You need to talk to the role player, whatever the examiner is giving you the question. He will ask you, okay, explain this to the patient. So how you will talk to role player, how you will explain this diagnosis to her. Okay, so how you're going to treat her, tell her that what you're going to do. Okay, then in between they will ask you different questions. So be prepared for all sort of situation where the examiner will ask you to talk to role player, where the examiner will ask you a question and you need to answer the examiner. As far as the marks distribution is concerned, these marks are distributed among these two examiners. Once you stand for the examination, is in the history taking, both the examiners will be sitting and they will be closely observing you. But in the examination, one of the examiner will stand beside you or along. Once if you're standing on the right side, he will stand on the left side of the mannequin or at the foot end of the mannequin and will examine you and will observe you that you performed your examination, and he will mark you for that. Then after this, once you finish, this will be a duration of 25 minutes where our examiner will be asking you all the questions. And once you finish your viva, you have to, even if you finish your viva before the time and you still have the time, then you have to sit in the cubicle. You have to wait for the bell to ring. And once the bell rings, you have to thank your examiner, you have to thank your role player, and then come out. Then you will have a gap. Once the OSCE station finishes, then it will be your turn to go to the OSCE stations. There will be a gap. And once the OSCE station people finishes, then they will be assigned a long case. And in one day, the same long case will appear in the morning and in the evenings, in the evening sessions. But the candidate who are with the morning session candidate, so it's not possible for them to tell them what's going on in the exam. But the exam is very in this station where you will be once you finish the long case, you will come out. You will wait for the OSCE candidate, then it will be switched off. Those who are gone for the long case, they will go for the OSCE. Those who have gone for the OSCE, they will go for the long case. This is how the exam morning runs, and usually it finishes if you start around 8:39 in the morning. By 1 p.m. to 2 p.m., all the exam is concluded. So this is all about the long case. This is what I have already spoken to you. That will be an obs and gynae, 25 minutes, take a history examine and discuss the case. Here you will, what domains you will be tested? You will be tested in your clinical knowledge, in your physical examination, in your differential diagnosis, as well as in your clinical judgment, risk management, managerial skills, clinical communication skill with the examiner as well as with the role player, managing relationship with your patient, and managing the patient's safety and the quality of care. Although it's a long case and you are speaking to the role player, you are switching between talking between the role player to the examiner, you're examining the patient, everything is going side by side, but you are being observed in all these domains by the examiner, and these domains are in the examiner key where the examiner is going to assess you. Next, this is how the room looks like once you are sitting. If you are sitting, you will be sitting on the two examiner will be sitting on the one side of the table. You will be sitting on the other side of the table. The role player will be in front of you. Your chair will be in front of the role player, and two examiner will be sitting on the other side of the table. And on this side of the table, you will have, once you finish your history with the role player, then you will take the permission from the examiner, and you will express that I'm going to examine my patient. So then there will be a mannequin on the bedside, and you will stand on the right side. The examiner will stand here on the foot end or on the left side, and will completely will observe you during the examination. He may order you sometime during the examination perform this grips, particularly in obstetric case. They will ask you what type of grips and what type of manures you are using to palpate the baby head, or to palpate the baby presenting part, how you're going to check the engagement. They may ask you different examinations to perform. And this examination will not only include the general examination, not only include the specific examination, it will include the general examination as well. If we talk about the OSCE stations, they are multiple stations, but in OB/GYN, they are total 7 stations, and each with a specific clinical scenario or task. Each station has a limited time, typically 10 minutes. Now, if we talk about the OSCE stations, there is total 8 stations, in which 7 stations you will find either the examiner or the alone, or either the examiner along with a role player. There will be one examiner in each OSCE station, and there will be, if you have, there is only one stage in 7 in 7 stations, 6 stations you will be interacting directly with the examiner. The candidate and the examiner will interact directly. This one station will be the one where you have to communicate with the role player, and the examiner will be observing you, and that is the communication skill with the patient. There you are being assessed totally how your communication skill with the role player or with the patient is. So total 7 stations will be there, OSCE, in which 6 will be with the examiner and 1 will be with the examiner plus role player. Along with the 7 station, you will have 8 stations totally, in which 7 will be exam station. One is the rest station, which comes usually after, once you finish your 4 OSCE stations. The 5th one is your rest station, where you can take a little bit of taking deep breath, get relaxed, and get yourself prepared for the next coming 3 stations. And each station, once you finish your 1 station, the bell rings, you will move to your next station. Once you will wait outside that cubicle, once the bell rings, you will enter into that station, at that OSCE station cubicle, where you will greet your examiner. It's depending on the good morning or good evening time, or hello, hi, whatever you want to say. Greet your examiners, sit down on table there. Once you sit on your table, there will be a scenario in the one paper, which will be there on the table for you. And once you you will start reading your scenario, because once you enter the cubicle and the bell rings, your 10 minutes start. So just immediately quickly greet your examiner, sit down and start reading your scenario. And then once you read your scenario, then you tell your examiner that I'm ready for the station, I'm ready for the discussion. And the examiner will start you asking questions, or if the questions are already being given in your scenario to you people, then in that case, you will start your discussion with the examiner. Now, what skills you are being assessed in these OSCE station? Your history taking, gathering relative information from the patient. Even if there is no patient, the examiner will ask you, so what information you will get from the patient? What, like obstetrical history, menstrual history, gynae history, any relevant medical history, like history taking. It can be a physical examination, clinical problem solving, communication, which is a role player station. They will assess you always. There will be one station in which they will assess you for interpretation of data, which usually they give in the form of the HSG is given to you, or some CTG, or some labor ward scenarios are being given to you. And then they assess you in these in the data interpretation session. There is always, most of the time, although the station does changes, most of the time in these sessions, we have the one station is in these OSCE station is about some surgical procedures, which in mostly sometimes the vaginal hysterectomy steps or abdominal hysterectomy steps or laparotomy step, or sometimes they ask you about the steps of laparoscopy or even hysteroscopy. Sometimes they give you instrument and they let you to explain to them that how to apply this instrument and what are the indications. So it can be different type of scenarios in the OSCE stations. Now, if we will briefly talk about the role play station, that if you get a role player, then how you will be doing the role play stations. Take care of few things when you're performing the role play station. You enter this cubicle with a smile. The most important thing in this exam, MRCPI OSCE exam, is your confidence and your self-confidence, and don't get your nerves to be disturbed. Don't be nervous, get confident and keep your nerves intact. This is a very doable exam for everyone. Look confident and you should be friendly. Introduce yourself. Never talk with the examiner. Speak clearly and keep a good eye contact with your role player. Behave naturally, feel like as if you are in your clinic and you're talking to your patient. Once you enter the station, before that, look at your watch, although the bell will also ring. During conversation, don't look frequently at your watch if you want to assess that how much time is left and how. But you believe me, once you are in the station, then there is no much time to look for the watch. Once you are in conversation with your examiner, then you're totally in that situation. So it looks difficult to look at the watch. Practice the finishing on time. But the thing here is that how you will master yourself to finish your task in 10 minutes. This is where your practice comes. Once you practice with your candidates, once you have the practice with your role, practice with your colleagues, with your friends, once you perform different tasks in the courses which you have attempted, then and you practice, it will adjust your time, and with the practice, it will comes that your task will automatically finish in 10 minutes. Depending on your history and your scenario, you will start talking to a patient, and depending what history investigation she need, you will take 2 to 3 minutes or maximum 3.5 minutes for your history, then examination, and then you will discuss with your role player that what you are expecting for her and what you can do for her. If direct the patient toward your question, listen with empathy, but keep the consultation in your control. Yeah, this is important, that don't let your role player to take control of you. You have to take control of your role player. Although it's a technique, you allow your role player to ask the questions in such a way, to ask the question and answer her in such a way that don't lose your control on your consultation. Discuss about the treatment option. Test her knowledge first, that what she knows about her situation. Has she any idea what she is suffering from? If she doesn't, then you have to start from beginning. If she knows, then you have to start from the point where what she knows. Give information in small, give always information in small chunks, and check her understanding 2 to 3 times. Give one patient information leaflet, give her follow-up appointment if it's required. And if the scenario is like this, where a multidisciplinary team is required, you have to apply that approach. And if everything is clear, if she want to ask something, and always thank your patient at the end if you are doing a role play station. If it comes a teaching station, then there can be a role player or examiner. Can be your role player, can be your student, intern, or resident, and he wants you to teach him. There will be always some model or a doll or a special needle for pudendal block, suture material for the knot tying. These stations, they assess your knowledge of procedure, basic knowledge, and teaching skills. Although previously in MRCPI OSCE exam, there was teaching stations. In recent exam, there are not much, but still you never know what they gave in exam. So you have to be prepared for everything. In teaching station, important thing is that from where you have to begin, because such a big topic, if you cannot teach her everything in 10 minutes. So you have to ask from the student or whosoever with you who want to learn, that what's her basic knowledge, and you start from there and ask her what she want to know, what she knows and what she want to know from today consultation, what is her expectations, and then start from there. In teaching, if you have a teaching station, you have to appreciate her. You have to appreciate her, ask her feedback at the end, and give her some reading material or something to guide her further, as well as to receive your feedback from about your teaching. as well as if she give her advice that if she want to come back to you at any time, you are free to guide her further. The important station, the breaking bad news and the difficult patients you may get. This is a role player station. While breaking bad news, there are, we know that there are rules for the breaking bad news, that by breaking bad news, you have to give her in first and then tell her that what I can see that you always tell her that I can see that you are here alone. And do you want someone to accompany you, or you want my nurse to be, you want your partner to come with you? Then I don't have a good news for you. And I'm sorry to tell you that you are diagnosed, suppose she is diagnosed with a cancer endometrium. See, endometrium, you will diagnosed with the cancer of the womb. Don't hesitate in speaking this language in this sentence, because if you are hesitant, the patient will be confused. So you have to speak it very confidently, although in a very soft and empathetic way, and immediately console her that I know it's a very difficult and disturbing news. But the good news is that it is in early stage and it can be treated. Or you can, I know it's very disturbing news for you, but we are here to help you and to support you. And a team of doctors will take care of you, and we will try our best to provide you the best management option. So give her a bad news, but also give her help and support. Allow her to remain silent. Don't give her, once you give her bad news, give her few moments to absorb that bad news, to digest that bad news. And if she remains silent for more than 30 seconds because you are in exam, then you can ask her, because she is all right, and can I continue further? Do you want me to know more about the treatment plan, or you want another appointment? Of course, she would say, tell me, because you are in exam situation. And here you will need some MDT care as well. Then if you are having a difficult patient, the patient is very angry, she's disturbed, and you have to console. So once the angry patient and the difficult patient is the examination, is your examination, that how you deal with this type of patient in your clinic. So the idea is what is required on your part is that you should be empathetic, you should listen to it carefully, listen to the patient very carefully, and let her come out, bust herself out. Whatever she want to speak, let her completely speak that out. Listen to that carefully. And then once she stops speaking, then you take, then you start, start to explain, but don't be defensive in your explanation. If something went wrong, accept that, yeah, something went wrong, and we are investigating it, and we are taking it seriously, and we will investigate further, and we will let you know. Like, let the role player angry patient understand that if she is angry, we are agreeing with her, we understand that she is angry, and we will try our best to help her and to solve her problem. Now, if you got the prioritization station, which you get in the labor, in the case of which mostly are the labor ward prioritizations cases, sometimes you may get the operation list or GP letters, but most of the time nowadays the candidate are getting the labor ward prioritization. You should know which case is your urgent, which case is your routine case, and waiting time for suspected cancer, like if it's a gynae case. So you should know that which patient requires 6 week, which patient require the quick referral pathway, 2-week referral pathway, which require a 6-week referral pathway. So you should be aware about that in case of gynae patient. In case of labor ward prioritization, if you got labor ward prioritization case in the exam, then in that OSCE stations, first take around a minute or a 1.5 minute to observe all your cases, so that you can prioritize, and then you start prioritizing your case and managing your case. If you got a critical appraisal case, it can be medical literature, it can be patient information leaflet or a general article. Usually nowadays in MRCPI exam, they are not giving these type of stations. Then progressive viva. Progressive viva mean the examiner is giving you a situation, and then he is giving you the patient investigation turns out to be this. Like if you got a patient of 50-year-old female who is referred with pelvic abdominal mass, then they will ask you, okay, so further information, what you will get. Then he will give you, now this is the scan report of what is your differential diagnosis. Then what investigation you are going to offer to this patient. Then what are your general and specific investigation, where you will refer her. Then if this turns out to be ovarian tumor, then what surgery you will do, steps of staging laparotomy, when you will start chemotherapy. Like they will give you what is the risk of recurrence. So it can be a progressive type of viva as well. So these are the different type of OSCE stations which you get in your exam. Now, if we talk about your preparation strategies, that like what are your preparation strategies, means that how much time you require for your MRCPI OSCE exam preparation. Believe me that if you are preparing, if you have done your MRCPI OSCE written exam, then you require the 2 months time. You require 2 months time for your exam preparation for the OSCE if you are fresh with your knowledge. But if you don't get immediately the seat for your exam, then in that case, advice will be that daily revise the bold points of your guidelines, because this will keep you in touch with your guidelines. And once you are once you prepare for your start preparing for your OSCE exam, then it will be very easy for you. You will be in touch with your knowledge, and just going through your summaries, because the med home exam is providing you with a very concise and very well organized summaries. So if you go through those summaries as well, that is the preparation for your exam. And one is your knowledge exam, one is your knowledge, that you should be up to date in your knowledge. Because the Royal College of Ireland has recently published a lot of new guidelines, and it has been seen in last 1 and 2 years that majority of their exam stations are all from the recent guidelines. So it's easy, it's a bit easy for the candidate appearing these days now in exam, that they should be very thorough in all those guidelines which are very recently being published by the Royal College. So if you have a very well knowledge about those guidelines, then you can because most of you will get your long case from those guidelines, you will get majority of OSCE station from those guidelines. So be ready for your with your knowledge. As far as it's concerned, the clinical knowledge, you should be up to date with the recent guidelines of the Royal College of Ireland. Now, once you have a knowledge, the next step is that you have to speak up that knowledge. Now you have to speak up that knowledge, and it requires that you have to speak up in 10 minutes. So that requires that you practice your stations in the groups, and you will practice what type of station, as I said, the recent guidelines. And there are recalls available like the previous exams. Once the candidate come out of exam, they do help the other candidate and tell them that these were our exam stations. And although the exam station changes a little bit, but you get idea, and then practice along with those recalls, along with the practice those recalls in your groups along with your friend. Make a study buddy, because OSCE exam is not possible without a study buddy. So you should have a minimum of 2 to 3 study buddies, because maybe if they are of the same time period, like the same time zone, then it's better. But if you get something from the other time zone, that's also acceptable. You should have at least a group of 3 to 4 candidates who are preparing together. If you practice together, that's better. If the advantage of having 3 to 4 or 2 to 3 study buddies is that if one of your study buddy is busy in some life or on duty or busy with the family or kids, then you can practice with another one. Similarly, once they get free, he can get time and can practice with another one. So make a group of 3 to 4 and practice your stations. Practice your stations. Once you start speaking your stations, particularly it's important that you practice your stations. You mastered yourself in examination. You mastered yourself in history taking, because in long case the history is very important. If you start your history properly with the confidence, and you go with the template of the history and you don't miss anything, believe me, the examiner makes the mind that I have to pass this candidate. Once your history is perfect, once you start your history in a perfect and a confident way, and you go through a systematic way in your history, and then once you go to the examination and you practice examination it requires the practice, that you practice examination on the mannequins. You let your child to stay, because the mannequins are not available at home. You let your child or let your husband to be with you, or if you're anyone at your home, and you can practice your examination. This practice will make you perfect, will make you confidence. And once you are in the exam, this is something on your fingertips, and you will go through smoothly, and you will not miss anything, and you will be very confident, and you will go through this exam, and you will be able to pass it in first attempt. If you don't have any study buddy, what you can do is that you can record yourself. and then listen to yourself again, and then pinpoints your difficulties, and then practice under time conditions. And it's important that you must attend a regular course for the ASCII exam as well, where you will be guided, because this will, once you attend a course, this will streamline your preparation in a way that daily you will be given some task, 1 or 2 tasks that you have to prepare these tasks, practice with your study buddy, and it will organize your preparation. They will give you a schedule that how we are going to prepare, and then you can, according to that schedule, if you're going, by the time you reach your exam, you will be able to, you will be ready by that time. Important point about the Royal College of Ireland about the ASCII exam is that once, how you will come to know that you will get your seat is that you will get your seat by the time 1 month, it will be around 4 to 5 weeks are left for the exam. Once you came to know that, yes, I have booked for my exam, and then you will be, I have booked for my exam, and then you will be, that 4 to 5 weeks are very critical for you. So you start your preparation 2 to 3 months before, and once you get the seat, then by that time you keep your seat, you keep yourself more organized, and you get yourself streamlined, and then by the time the exam date is there, you are ready for your exam. The common mistakes which the student make is that they are rushing without structure. They don't know what they have to do in the long case. In the long case, once you are preparing for the long case, there will be sections of the long case. One is your history taking, other is your examination, and the third is your discussion. So you have to master your history taking, you have to master your examination, and you have to master your discussion. If you have the clinical knowledge, your discussion will be still how to apply that your clinical knowledge, and how to answer the examiner question, that also requires the practice. But important in long case is your history. Your beginning of the station is very important. So you have to prepare different flashcards for different type of history, like obstetric case, long history, how you have to take. In gynec case, how you have to take the long case history. So you have to prepare and organize yourself, and you should know your template of history. You should know your points of examination, that what I have to do in examination in gynae case, what I have to do from the beginning of examination. I have to sanitize my hand after, I have to take permission from the role player. I have to uncover my mannequin. I have to cover my mannequin at the end. I have to clean my hand. I have to thank my patient. So this require practice. Once it is in your practice, your examination will be perfect. How you will perform different maneuvers in examination, how you perform auscultation, how you will perform the palpation, how you will perform the inspection. So all these steps of examination you have to practice, and you will be able to do it on the exam day in a perfect way if you are in practice. Missing the red flags. There will be some red flags in the station, which will be given to you by the role player, which will be given to you by the examiner. That if you miss that, it means you are missing something. Ignore the patient concern. If the patient is asking you something, if she asks you one time, you didn't pick, maybe the role player is good, she may ask you second time. And if you did not pick that, this is ignoring patient concerns, and this will because you're not concentrating on your patient. This means you're not good in communication. This means you are not good in listening to the patient. So this is something which is not good in as far as your marking is concerned. Poor time management. If you are keep on taking history in your OSCE station, which is 10 minutes, if you take 6 to 7 minutes for your history, then definitely you are left with the 2 to 3 minutes, and many of the points on the examiner marking scheme is left empty because you didn't touch that. So that's poor time management is not going to help. And how to cover it? The time management is being covered only if you organize yourself and you practice your station from the beginning. And if you're discussing with a role player, even if you're discussing with the examiner, if the examiner is asking you how you will explain this condition to your role player, it means the examiner wants you not to use the medical jargon, but to patient safety, patient friendly language, and they want from you to explain this condition to the patient in a safe way. Scoring method. If we talk about the scoring method, the examiner will understand the marking sheet on the clinical communication skills, on your interaction with the patient, clinical techniques and findings, your differential diagnosis and recognizing the clinical condition, clinical judgment, and recognizing the red flag and the patient safety. Now, if the marking is concerned to achieve the passing marks, it's important to pass your clinical exam means your long case. You have only one long case. There is no other long case, so that if you miss something in one long case, you will be covered by the another long case. No, it's not like that. You have to pass the clinical examination. You have to pass the minimum number of exam ASCII stations, and you have to obtain the overall minimum pass mark. If you miss something in ASCII station, one or two didn't go well, that can be covered by the rest of the 5 ASCII stations. But if you miss something important in your clinical examination, it cannot be covered. That's why it has been seen that most of the candidates who pass their clinical examination, long case, most of the time in the MRCPI ASCII exam, they are being passed. But if you could not perform well due to any reason in your history, if you could not pick up the diagnosis, or if you did not perform the examination well, you did not satisfy your examination, your clinical examination, your examiner in your long case, it's very difficult to pass the MRCPI ASCII exam. And one thing important about the ASCII examination, a trick which I am telling you here is that the important trick is that if the examiner is satisfied with you, and how you will understand that your inner self will tell you that you performed well or not, because it's yourself ultimately who can judge yourself, and your examiner who can judge yourself in the exam. So because of a person can be a very good judge of himself or herself. So if the examiner is taking you toward the end, if he is asking you about the examination, about the investigation, diagnosis, treatment, if he is asking about what is the risk of recurrence of a condition like this, if he's asking what will be the follow-up of your patient, if it's an obstetric case, what will advise you will give to the patient, and then for the next pregnancy, what will be her pre-pregnancy counseling in the next pregnancy. If the examiner is taking you toward the end of your station, it means it's a sign that examiner is satisfied and you are going to pass this exam. But if you are stuck somewhere in between the station, then it's difficult. But it's very important in an MRCPI ASCII exam to pass your clinical examination. But it doesn't mean that you don't concentrate on the ASCII. You have to pass the ASCII examination, and you have to obtain the overall minimum passing mark, and that is determined by thorough data analysis, and that's their own internal assessment, which minimum examination, which have been preset by the examination result, are confirmed by the board of Part 2 ASCII clinical examination after thorough data analysis and rigorous standard setting. And when you will get your result, most of the time before 3 to 4 weeks they take to give you the result, and that will be through email. Now, tips for passing for the exam day, that what you will do on the exam day. It's very important that your first look, your personality look, your dressing is the most important thing. You should dress professionally. Be calm, polite, and confident. Believe me that if you are confident on your exam day and you are not getting yourself nervous, and you enter into your cubicle, that is for the ASCII station, or that is particularly for the long case, if you start your station confidently, in the long case, particularly your history taking, that is the first step the examiner is assessing you, is your history taking. And if you start it very confidently with your role player, and you're talking to the role player very confidently, the examiner get impressed. You're talking politely, you are asking, you are understanding the role player, you are asking her, you are answering her questions, you are asking the relevant question, you are showing empathy where it is being required to be shown, you are listening to your role player confidently, and you are showing confident, and you're not showing yourself confused and like thinking about your question at that last moment. No, if you're very confident, believe me, the examiner mind is being made there that this candidate is perfect. You speak very clearly to your role player, either to your examiner. Always make eye contact with your role player as well as with your examiner. This exam is not possible to without a study partner. You should, and regarding the studies, you should study the guideline summaries and the talk articles. Patient information leaflet need to be read for the clinical scenarios as well as relevant guideline. Revise the station from different ASCII books, as well as it's very important to have the past ASCII recalls, and then you can that will be enough for your preparation. If you are looking for if there comes an emergency situation or some instruments are there, you should go to your theater, you should go to your labor room, ask for the forceps, for the bentos, and practice there on the doll. Before the exam date, eat small frequent meals during the study time, take to 7 to 8 hours of sleep, and starting at least 2 weeks before the exam, because this is very important that you should have a very good sleep, because if you are fresh on the exam morning or for the afternoon exam, this will make a lot of difference, because everybody is coming for the exam not without preparation. Most of the candidates, they have prepared very well, but they could not sleep due to anxiety and stress, and that ruins their 2 months or 3 months preparation, and they could not perform well only because they could not sleep well, and they were anxious and they were very sleepless and their mind couldn't work. So it's very important to set your sleep pattern minimum 1 to 2 weeks before your exam. If you did not do well in your 1 or 2 stations, don't worry about that. Once you finish a station, didn't go well, just leave behind that and concentrate on your next station, and leave everything, just throw it at the very back of your mind. And once you will sit later on, then we will see. Then you will see what you were to analyze yourself. That is something once you fare your ASCII station, once you fare your whole exam day. But don't get yourself in panic. I didn't perform well. Because if you didn't perform in 2 stations and you put it on your nerves, it's going to ruin your next 5 stations. So it's very important to be ready in your leave behind whatever you have performed in 1 station. If it doesn't go well, leave behind, throw it at the back of your mind somewhere, and get ready for the next station. Do recalls. It's very important to do recalls and practice with your friends and with your study buddy. A day before the exam, stop reading, enjoy, relax, sleep early, wake up early, take a bath, eat light breakfast, nothing heavy and calm, and you can do it because we have done it. Everybody have done it till now. So you're not something different. If we can do it, then everybody can do it. Resources for these is the RCPI guidelines. As I have told you, that now the exam is totally dependent on the very recent RCPI guideline. So next comes the TOG articles and the RCOG guidelines. You should take a fast track course or you should take a long course. You should have a group or a study buddy of 2 to 3% where you can practice your sessions or stations. And the important, now if we coming to the syllabus of the how to prepare for the MRCPI OSCE exam, we have the general gynae session. General gynae, which include the menstrual disorder like the premenstrual syndrome, dysfunction, menorrhagia, heavy menstrual bleeding, fibroids. On fibroid, always there is a gynae station. You will always get a long case. Most of the time, they give the fibroids as a long case. If there is some OSCE station on uterine artery embolization, endometrial ablation, dysmenorrhea, primary amenorrhea and secondary amenorrhea are their favorite topics. And then postcoital bleeding, intermenstrual bleeding. Recently, you should check about all the recent guidelines which are being published, as well as all the recent talks which are being published. Most of their stations are from there. Endocrine problem like polycystic ovarian syndrome, premenstrual ovarian insufficiency, hirsutism. Hirsutism is one of the favorite topic. Primary amenorrhea is the favorite topic of the RCPI exam. If you talk about the menopause problem, yeah, they do give the OSCE stations and the menopause, how to counsel patient on HRD, postmenopausal bleeding, osteoporosis is favorite topic of RCPI. Although it doesn't come much in OSCE, but it's the written topic. It's very important topic in the written exam. Adolescence gynecology like developmental abnormalities like ambiguous genitalia, imperforate hymen, septa, uterine anomalies, and gonadal dystonia, primary amenorrhea, as I told you, pelvic pain problem like chronic pelvic pain, dyspareunia, endometriosis, ovarian cysts, and like the sexual assault, RCPI has a very separate guideline on sexual assault. So they will give you all these all problem, all these any topic they can give you from any of the module. Early pregnancy, you will talk about the miscarriage. Ectopic pregnancy, you should know about the recurrent miscarriages. Particularly, they have a new guideline. Similarly, hyperemesis gravidarum, molar pregnancy. If you talk about the infertility, all the problems in infertility, male and female infertility. Similarly, urogyne module, gynecological oncology module. If you come to the obstetric module, there will be antenatal care, maternal medicine module. So maternal medicine module, then we will have the surgical module, which will be different type of surgeries. As I have told you that there will be surgical module as well. Similarly, different type of emergencies which are being taught, and as well as the clinical governance and audits. So this is all about your syllabus. But most of the preparation regarding the ASCII exam is being prepared. The candidates are being prepared on the module wise, so which every module is being covered, and as well as the recent guidelines, as well as based on the past recalls, which came in the last exam. So this is how you will, this is the syllabus for your MRCPI exam, and this is how you will prepare for your exam station. So if anyone have any questions, I am open for the, any question I am open for. Otherwise, this is how what the RCPI exam involves and how you have to prepare for this exam. If you don't have any questions, so this is all from my side.
For a nice session. You explained everything very nicely, and I think candidates will get many things from here, and they will take home messages from there. So it will help them to pass their exam. And I think nothing for me to speak, but just a few things that when you are preparing for exam, you need some mentors and join. Even if you don't want to get the paid, there are free groups also, so you should join these free groups and participate actively in these groups, from where you can get your study partners also. And whenever you will send your stations, there are mentors who will correct you. So without practice and without the involvement of mentor, it is very difficult to pass these exams. So Dr. Khalda has explained very nicely. Good luck from my side. Good luck. Any questions you want,
Thank
Dr.
you.
Khalda?
Thank you, Dr. Wazia. Thank you for joining. And I hope so this introductory session will help the candidate to know how what the MRCPI ASCII exam is and how to start their preparation and how to go ahead in their studies and to get this, to be the member of this prestigious College of Royal College of Physicians of Ireland. Thank you.